Miscarriage, so devastating and so common. Nobody talks about the fact that they've had a miscarriage until you mention that you've had yours. But it's really quite common. About 10% of pregnancies are lost when women are young and fertile. By your mid to late 30s, about 15 to 20% of pregnancies end in miscarriage. By the time you're in your 40s, it can be as high as 20%, and in your late 40s, 53% of pregnancies, that's 1 in every 2, end in miscarriage. It's awful. Why do people miscarry? Miscarriages occur mostly because nature wants to get rid of an embryo that's not normal. The earlier your miscarriage, so if it happens before you're 7 weeks pregnant, it is highly likely, over 70% of the time, it's because the embryo was abnormal. Later miscarriages might be from chromosomal abnormalities, but we often have to look deeper into other causes of miscarriage. One miscarriage is very common. Repetitive miscarriages is much more rare. Indeed, only 1% of couples experience 3 pregnancy losses in a row. Because it's so devastating, we now do a workup after 2 losses in a row. We don't want women or men to suffer the pain and anguish of the 3rd loss. So convention now is the definition of recurrent miscarriage, 3 losses. The evaluation, 2. Don't wait for that 3rd loss to go see the doctor. What are the different reasons for repetitive miscarriage? 1 to 4% of the time, mom or dad carry 2 chromosomes stuck together. When they go to make their eggs or their sperm, those chromosomes travel together and the embryo is imbalanced. It's a rare event. 96% of the time, you're not going to find a problem. But if it is the problem, we just have to keep trying or find another way to diagnose that that embryo we're putting back in is normal. So that's one cause of repetitive miscarriage. Anatomic factors. A good 20% of the time we might find something wrong with the uterus. We look for polyps, we look for fibroids. Those are growths that are in the uterus. Those can be surgically removed. We look at the shape of the uterus. It's kind of funny. Women are born with 2 uteruses and they meet in the middle. And they're supposed to end up with 1 normal uterus. Sometimes they end up still with 2 uteruses or a mixture, endocrine. We like to make sure that a woman has all the right hormones and she's healthy. Out of control diabetes increases the odds of miscarriage. Thyroid antibodies or out of control thyroid disease may increase the risk of miscarriage. Prolactin levels in some studies suggest that they can affect miscarriage rates. And the all-important one, your hormones from your ovary. So again, we check for estrogen and progesterone, and we check again for your ovarian age, because remember we said if your ovary is getting older, that may affect the odds of getting a miscarriage. There are some rare syndromes that increase a woman's odds of having a small blood clot. These blood clots can affect and increase the odds of miscarriage, as well as adverse pregnancy outcomes. We check women for anticardiolipin, lupus anticoagulant, and a beta-2 glycoprotein if she's had repetitive miscarriages, late miscarriages, or an adverse pregnancy outcome like a placental abruption or early preeclampsia. These are important because we can treat this with heparin and aspirin, blood thinners. These are some of the reasons that people have repetitive miscarriages. Unfortunately, about 48 to 50% of the time, we can't uncover the reason for the repetitive miscarriage. There are things we can do that might make it better, but we haven't figured out all the different reasons that people miscarry repetitively.